In this video, I'm going to talk about 10 things that an L4-L5 disc bulge patient needs to know for a speedy recovery. If you had an MRI report, you've been told you have an L4-L5 disc bulge, even an L5-S1 disc bulge, this video is still relevant for L5-S1 disc bulge. This is a perfect video for you. I'm going to go over these very important things that you need to know for a speedy recovery. As you know, L4-L5 disc bulge, even L5-S1 disc bulge, causes a tremendous amount of pain, problems, difficulty, challenges, limitations, whether it's back pain, leg pain, numbness, tingling the foot, even muscle weakness, and on serious occasions can even compromise the nerves that goes to the bladder, bowel, need surgical requirements. So it's important to know the things that are available for you to help get you to get through this condition a lot faster. So that's what we're going to talk about today. So the 10 things, I'm just going to outline them now, and then we'll get into them one at a time. First one is what's causing the pain at L4-L5 or L5-S1 associated with that. Number 2, what treatment options are available for this condition. Number 3, how long will it take to recover from the injury? Number 4, if surgery is necessary, what are the risks and benefits? Number 5, how can you manage the pain in the meantime? And number 6, what lifestyle modifications can you make to prevent further injury? Number 7, will you be able to return to normal activities or work after treatment? Number 8, how effective are different types of treatments such as physical therapy, chiropractic care, or medication? Number 9, how can you improve your overall spinal health and reduce the risk of future injuries? That's super important. And number 10, what videos are available for support and education about L4-L5 disc bulge and L5-S1 disc bulge? Hey there, I'm Dr. Walter Salubro. I'm a corrective care chiropractor in Vaughan, Ontario, Canada. What this channel is about is giving you tips and strategies on how to strengthen and stabilize your back. Like this, you can bend, move, and lift normally without pain and limitation. Plus, I introduce you to corrective chiropractic methods and techniques that we use in our office, possibly something you can look for as well to see if it can help you. So if you want these tips and strategies, you want to learn about chiropractic corrective techniques, do subscribe right now. Tap on that button below. It says subscribe. Click on the notification bell. Like this, you don't miss out on my future video updates I put out each week. Plus, if you're brand new and you just subscribed, let me know in the comments below and I'll personally reply back with a thank you. So number 1, what is causing the pain associated with L4-L5 disc bulge and even L5-S1 disc bulge? There's 2 components to this that I want you to understand. Number 1 is the disc injury itself. The disc is a fibrocartilage structure with a nucleus pulposus on the inside. When everything's great and it's not damaged, it's not a pain generator. But when the disc itself is injured or damaged through annular tears, through injuries to the actual disc, it will cause an inflammatory response. So the disc tissue is highly sensitive to the chemicals of inflammation, causing a tremendous amount of pain at that local disc area. Plus, usually the disc itself is not involved on its own. There could be spinal distortions and misalignments. That alone can affect the muscles and tendons and the ligament capsules in the local area of that spine. Those are all pain generators as well. So that's number 1 in terms of the local tissues. Number 2, when that disc begins to progress, becomes more of a protrusion, herniation, or a bigger disc bulge, it can go posterior and affect the nerve inside the spinal canal. Not a good thing. And it can also go posterior lateral and affect either the transverse nerve root or the exiting nerve root. Usually L4, L5, and also S1 can be affected. Those nerve roots, they form the sciatic nerve. The sciatic nerve, as you probably heard, goes down the back of your thigh, into your calf, into your foot and toes. So pain associated with that nerve impingement or nerve entrapment can be shooting leg pain, sciatica style leg pain, can be numbness and tingling into the legs, into the toes as well, into the foot and toes, and also cramping feelings either in the buttock, thigh, and calf. So those are the typical signs and symptoms that will be associated with an L4-L5 disc bulge or an L5-S1 disc bulge. So what treatment options are available for this condition, for L4-L5 disc bulge, L5-S1 disc bulge? There actually are a variety of different treatment options, and I'll just kind of list some of the more common ones. So number 1, you can just do something at home like exercise to try to control the problem, and in some cases that has helped people. You can also seek now professional treatment. Professional treatment options can be things like chiropractic, and I'll talk about the effect of this later on, but chiropractic, there's physiotherapy or physical therapy, which they use either exercise and a series of physical therapy modalities like electrical stimulation, ultrasound, laser, and so forth. There's acupuncture. There's massage therapy for the soft tissues. Of course, there's medicines through the medical doctor and injections for pain relief, nerve blocks through the pain specialist. And on the opposite side of all that, there's surgery if required as a treatment option. So that's kind of like the spectrum of the treatment options for an L4-L5 disc bulge or an L5-S1 disc bulge. So number 3, how long will it take to recover from this injury, from an L4-L5 disc bulge or an L5-S1 disc bulge? Well, there's many factors that are involved. It's not a simple answer, but let me give you some benchmarks based on the experience that I've had with my patients over the last 22 years. In my experience, when someone gets an L4-L5 disc bulge or L5-S1 disc bulge and they're getting treatment as soon as that injury happens, so within weeks, maybe even a month, so it's a brand new injury and they're in the acute phase of care or acute phase of tissue healing, then I can see patients get better within about 3 months or so, 3 to 4 months, some earlier and some a little bit later. I've had many patients when they've come in at the start of their L4-L5 disc bulge injury and symptoms, or at the start of their L5-S1 disc bulge injury and symptoms, and they're getting started with their treatment. Generally within the first 3 months, they're doing a lot better. Now, the other factor is if they've had a chronic L4-L5 disc bulge problem or a chronic L5-S1 disc bulge problem. What I mean by chronic is 6 months or longer. 6 months or longer, 12 months, even 2 years, 3 years, 4 years suffering of the symptoms of an L4-L5 disc bulge or L5-S1 disc bulge. For patients that have had this chronic issue for a long time, I've seen it take anywhere from 6 to 12 months to begin to see improvements and healing. So the more chronic the problem's been there, the more chronic the symptoms have been there, the longer it's going to take to heal. Okay? Now, again, these are benchmarks, these are generalizations. It doesn't mean necessarily that's going to be your course of healing, right? Everyone heals differently at different times. But generally speaking, the basic premise here is the sooner you get started from the onset of injury, the sooner you get better and heal. The longer you wait, the longer it's going to take. So number 4, if surgery is necessary, what are the risks and benefits? Well, as you know, I'm a chiropractor, I'm not a surgeon, so I can't speak specifically for the surgical procedures and the potential outcomes and prognosis. But just generally speaking, anytime you get into surgery, there's always going to be inherent risks. It's obviously not a conservative option. There's surgical intervention. They got to cut through the tissues, whether it's a small insertion or a more broader invasive type of surgical procedures. I know nowadays they actually have minimally invasive surgical options that have really helped a lot of people. But if a fusion is required, if there's bolts that are required, if there's plates that are required, like actual implants to stabilize the spine, it becomes more complex. So with surgery, there's always a risk for delayed recovery because of the surgical procedures. There's always a risk for nerve damage, and that comes with a whole bunch of problems. And the other thing too is even though the surgery will actually be successful from a surgical procedural perspective, what's the likelihood it's going to actually be very effective to control the person's pain, whether it's back pain or leg pain, right? So you don't know until you actually go through it. So in some cases, people get tremendous relief from surgery. In some cases, their back pain continues to recur. It's been often called a failed back surgery syndrome. That's been negated, that term, because the surgery was done right. It's just that the symptoms keep to reappear a few years later. So again, these are things that need to be discussed with your surgical doctor, your neurosurgeon, whoever you went for a neurosurgical consultation. And when is surgery really needed? Well, sometimes it's required because all conservative methods didn't help with the pain relief, and I understand that. And sometimes it's required when there's neurologic compromise to the nerves that control the bladder and bowel, and people now have urinary problems, can't empty the bladder, or have bowel problems and they can't go to the bathroom. So that's neurologic compromise, which is very serious and is actual surgical necessity to intervene surgically. So again, that's kind of a topic about surgery. It's not my area of forte or focus in my office, but there are things you need to know about and discuss with your medical doctor and surgical expert. Number 5, so how can you manage the pain in the meantime as you figure out your options? Well, we mentioned already exercise. I've had many people do the exercise on my YouTube channel, and they've commented below. It's helped them tremendously. For some people it hasn't, but for some people it has. There's things you can do at home, like hot packs and ice packs to relieve some of the pain associated in the lower back region. But truly, in most cases when it comes to disc injuries, you're gonna have to actually seek out some kind of professional treatments. And of course, with a consultation with your medical doctor, there's obviously medical and medicine options to help relieve with pain, painkillers, anti-inflammatory, muscle relaxers. Those are all options. Again, it's not in the scope of chiropractic practice. That's something you need to discuss with your personal medical doctor. So those are some of the things that most people will do. Will be either exercise at home, some kind of ice pack or heating pack, and some kind of medicine if they require with their medical doctor. So number 6, what lifestyle modifications can you make to prevent further injury? And I want to add to that also what lifestyle modifications can you do at home to actually help with the pain? Okay, so a couple things you can do. I don't think that you should actually be immobile or sedentary the whole time. I always tell our patients to move around, do some short walking to get the spine mobile, get those legs mobile. Just being sedentary just aggravates the spinal condition even further. So some light mobility, walking, 5-6 minutes tolerance is useful. Sit when you have to, stand when you have to. If you're standing, let's say working around the house or something, put a little stool under one of the foot so it gives some relief in the back of your leg. If you're sitting, put a little step stool under your feet, again, give relief in the sciatic nerve and the low back. Sitting, you can put a pillow under your buttocks and also behind your back to add some extra comfort in the lower back. Sleeping at night, some things we tell our patients is put a pillow underneath the knees. So they're sleeping on their back or on their side, put a pillow between the knees. Avoid things like bending, right, that can aggravate the problem, lifting. Stay away out of the gym when you have an active disc bulge injury. Just avoid things that can load the spine, either through bending, rotations, and lifting. Okay, so those are some of the things that you should avoid and some things you can do to either help relieve the pain and prevent this from getting worse. So number 7, will you be able to return to normal activities or work after treatment? I can just speak from the experience of my patients. We've got many patients that have come in with serious disc bulge injuries at L4-L5 and L5-S1. I mean, literally being carried by their spouse and myself down the hall to the treatment rooms because of how much pain they're in with their back. And with several weeks and sometimes months of treatment, we've been able to eliminate the pain for them, stabilize their spine, and get them back to their regular activities, whether it's at work, leisure, or at home. So we've had many, many success stories like that. Okay, so it is possible to get back to your normal activities. Most of the time, it's going to require some kind of professional treatment or intervention, like some kind of therapy or chiropractic adjustments, plus possibly, pain management through your medical doctor. It can all be used in combination. But in most cases, people can get back to their activities of normal living. So how effective are different types of treatments like physical therapy, chiropractic care, medication? I want to add even acupuncture in there. Again, I'm only going to speak to you from my experience. When it comes to medications, I'll just tell you what my patients tell me. Some people tell me it helps them. Some people tell me it doesn't. So again, that's a conversation you have to have with your medical doctor when it comes to medications. We do chiropractic care in our office. The premise for that is to discover the spinal misalignment and distortion that can be contributing to the disc injury, correcting that with corrective care techniques, whether it's adjustments, postural exercises, postural corrections, and traction work to restore that spinal alignment and postural position, relieve the abnormal loads on the discs that are injured. That will help to not just relieve the current pain, but also prevent it from reoccurring over and over because you're correcting and stabilizing the spinal structures. So many patients have done really, really well with that with us. Some patients will add physical therapy, either with that or instead of chiropractic and other things. So with physical therapy, there's exercises, rehabilitation, there's laser therapy, there's ultrasound, there's electrostimulation. So those are some options that have worked for people. And again, for some people, the physiotherapy and the laser therapy has worked better than the chiropractic, right? For some people, the medications work better than physiotherapy and chiropractic and so forth. For some people, the chiropractics work better than the medicine. So not one option is the right option for every single person. I think people should investigate different options, go with the one that works, and then stick with that. And if it's not working, then you have to seek something else, okay? Last one I want to add in there is acupuncture. I don't do acupuncture, I'm trained in it, so I know a lot about it, but we had many of our patients that have done acupuncture with other acupuncturists or other specialists that do acupuncture, and I found tremendous relief from that as well. So those are different options. They all work to some degree. The one thing I want you to understand about the different treatment options is they all have a different premise and outcome, right? So spinal corrective care, the outcome is to correct the spinal structure. Acupuncture, the outcome is to balance the energy and the meridian energies in your body and get the body to heal through those methods. Medicine is more of a biochemical way of relieving pain. Physical therapy is exercise and modalities to help with the inflammation, right? So they're all different, right? So one option will work better for one person and versus the other, and sometimes need to do multimodal and try a bunch of different things all in one. Okay, so those are different things you can expect from those different treatment options. So number 9, how can you improve your overall spinal health and reduce the risk of future injuries? So this is actually probably the most important one that you should pay attention to. One of the best things that can help people to improve their spinal health and prevent injury is to get that spinal problem corrected, to find out if there's any spinal distortions or misalignments away from the normal alignment positions and get them corrected. And one of the best practitioners to do that is a chiropractor or corrective care chiropractor. That's all we do all day long is we look for abnormal spinal problems and alignment problems and we correct them, right? And get them stabilized. So by correcting them, adjusting them, and stabilizing them, not only relieving the current issues currently that causing pain currently, but also stabilizing it and getting it stronger and preventing it from getting re-injured in the future. Okay, so a lot of our patients, not only when they go through their corrective care programs to get things corrected, they stick around for maintenance and supportive care for long lifetime spinal health. So those are things that are very important. So you should incorporate some kind of chiropractic corrections and maintenance for your spinal health. And again, other things are useful. So exercises to help stabilize the musculature of the back and core once you've had some good spinal correction through chiropractic. That's useful. Massage is great for soft tissue healing and soft tissue stripping and repair. So that's also useful. So those are things that can be done not just in the current moment, but also as an ongoing maintenance program to keep your spine and back healthy for the future. The last thing I want to leave you with is number 10, what resources or videos are available for support and education about this condition. As you know, you're on YouTube, so there's a tremendous amount of videos out there on YouTube. There are a lot of good videos out there on different channels. What I'm going to do is I'm going to list my top 5 to 10 videos on my channel about L4-L5 disc bulge treatment, about L4-L5 disc bulge exercises, mobility exercises, core strengthening exercises, information about healing times. Will this bulge ever get back to normal? I'll post all those resources and videos inside the actual description below this, so go check that out. And also there's a great PDF exercise book that I give away for free. Just have to opt in with your email. The link will also be below in the description. Check that out and see if that's useful for you. And having said that, the one video I want you to look at next is one of my most popular videos on my channel. It has 3 million views. Plus, go right here, you can see more information about L4-L5 disc bulge, the anatomy that relates to it, why it causes so much pain, and 4 great exercises that many people have found useful to help relieve pain associated with L4-L5 disc bulge. Right here, right now, go watch that right now.